It's not just the economy. Hospitals are feeling the pressure as the number of COVID cases increase on a daily basis. The latest statistics have been confirmed for COVID cases and deaths for the United Kingdom. In the last 24 hours, there have been 13,864 new cases diagnosed, and there have been 87 deaths in that time. This gives a total number of deaths so far from COVID of 42,679. And beyond the information on cases and deaths, there was a lot more published today about the extent of the virus and the R rate. The Office for National Statistics has surveyed the coronavirus infection rate across the UK. The ONS is yet to publish data for Scotland, but its survey suggests that in the 2 weeks to October 1st, around 1 in 500 people in Northern Ireland had COVID-19. Meanwhile, in Wales, in the last week of September, around 1 in 500 people there had the virus. In England, it's estimated the rate was 1 in 240, and another credible study out today suggests it could be even higher, as many as 1 in 170. It's the north where rates continue to rise more quickly than anywhere else in England, with around 1% of the population testing positive in the northeast, the northwest, and Yorkshire and the Humber. There, it's estimated that cases are doubling every 13 days, and across the Pennines, every 17 days.
And we can now go to Greater Manchester to our Home Affairs correspondent Darshana Soni, where the rise in infection rates has led to huge pressure on local industries. Darshana.
And it's concern about those rising rates, Matt, that has led the government to be considering what restrictions it should be putting into place here in the northeast of England. Local leaders have been very critical of the way in which ministers have gone about communicating or not communicating the nature of those restrictions. And today, in an attempt to appease them, a briefing was held with local mayors and the Prime Minister's advisor, Sir Edward Lister. He's since sent a letter to MPs, which we've seen, in which he says it's clear that local leaders should be consulted over the nature of those restrictions. Of course, that's what local leaders have been asking for all along here. And I understand that more meetings will be held over the weekend before a possible announcement on Monday. In the meantime, the hospitals here are having to cope with an increase in admissions. We've been finding out today how they've been preparing for the winter ahead.
In any other year, hospitals across Greater Manchester would be preparing for the usual winter pressures. But these are, of course, unusual times. There's been a significant rise in COVID admissions here, in an area with one of the worst rates of infection in the country.
How many patients do you have at the minute suffering from COVID in your hospitals?
There's around about 50 patients in critical care, and there's around 200 patients with a diagnosis of COVID on the wards at the moment.
So that's around 30% of critical care beds?
We're heading towards 30% critical care beds at the moment.
Dr. David Ratcliffe is Greater Manchester's clinical lead for urgent care. As the political row goes on over further restrictions for the North West, his team have been modelling worst-case scenarios.
That model doesn't suggest that we're going to exceed the critical care bed capacity, and we are also going to be able to maintain capacity to maintain elective work as well.
But you're not panicking at the minute?
So we're not panicking.
Still waiting on an official announcement on what sort of restrictions this region will be placed under. Local politicians have complained that decisions are being made in London without consultation that will affect millions of lives and livelihoods here.
What concerns me about restrictions is that the economic consequences of this are devastating, and what you've seen businesses do over the last 6 months is really adapt to trying to have COVID secure workplaces, to look at new ways of working. And the challenge comes in the uncertainty. So this uncertainty that from 1 week to the next, this can just change instantly, and that's making it very difficult for people. And if you take a look at the economic consequences of that, then I'm afraid that this is about people's lives and livelihoods as well as their health, and all of that needs to be considered in the round.
While some have taken a swing at the government's communication strategy, others have questioned the delay in implementing the measures, as the number of infections here per 100,000 is now 543 and rising. Johnny Lyons says he's aware that because of his age, he's classed as being high at risk.
I don't know why the government are waiting until Monday. They've been talking about it for a long time. I think they should institute whatever restrictions they need and feel appropriate immediately.
If that's necessary, it's got to be done. But keep the golf courses open. Keep other sporting venues open. Because if they don't, the people are going to rebel against it because they've got nothing to do. And mentally, it won't do the people of this country any good whatsoever.
Thank you.
The government is aware that trying to persuade everyone to club together may prove harder than it was back in March. At Manchester's universities, hundreds of students are still in quarantine, some describing it as a prison, saying they've been unfairly blamed for the outbreak. There are unconfirmed reports that a number of students who tested positive are in intensive care. The NHS Trust says it can cope for now. But it's not just COVID cases causing concern. They saw 40,000 fewer patients presenting to emergency departments during the first wave of the pandemic, and they worry health inequalities will widen.
We've looked at that in terms of which populations that affected the most. And the BAME community, actually, that they had the largest reduction. So the question there is why is that? So we're working on that now to make sure that those health inequalities are not just looked at, but they're built into our plans.
The new restrictions for this region are expected to be announced on Monday and coming to force on Wednesday, by which time the number of people testing positive will have continued to rise. Darshana Soni, Channel 4 News, Manchester.
Well, I'm joined now by Christina Pargel from University College London. She's a Professor of Operational Research and a member of the Independent SAGE Committee, which offers an alternative to the government's advisers. Professor, what does your analysis tell you about how urgent the situation is now?
In the north of England, I think it's very urgent. I was looking at the regional hospital admissions which you get from NHS England, and the northeast and northwest and Yorkshire, they're all at 25 daily admissions per million people and doubling about every week recently. And London on lockdown day, which was the worst affected place in March, that was at 40. I say that's less than one doubling away. So we're basically maybe 4 or 5 days in the northwest, northeast and Yorkshire of being where London was in March 23rd. And I think that is really concerning because London almost ran out of capacity.
Right, so in March the 23rd, we had a national lockdown, everything stopped. Now, we're not talking about that. No one's talking about that, in fact, over the next few days or weeks. So do you think we will have the same kind of reduction in the spread of the illness that we had in March, or will it be a shallower reduction?
It will, I mean, it has to be shallower, because people will be mixing more. I mean, that's how you bring the virus down, is you stop people mixing. But it should be enough to bring it below, to bring R below 1. Because basically what we're learning is that it's spreading through us being sociable with each other. And so, you know, it's kind of a choice between, do you get to see your friends and family and have the virus grow, or do you not and have it shrink? And I think, you know, I think we're going to choose the latter, and that probably will mean in the north closing pubs and restaurants. I imagine that's what they'll do.
So from your point of view, should this be done now, or is the government prudent to wait to telegraph its intentions, to take the public with it and then bring it in?
No, it should be done now. Like, if you know you're going to do it, just do it, because then you've got 5 more days for it to grow and grow, and it'll take longer to come down, and restrictions will have to be there for longer. I mean, we learned that back in March, where they think now that that extra delay costs thousands and thousands of deaths, and we're not in that situation yet here. But waiting is not going to help. It's not going to help anything.
Well, you say, I mean, there are experts on your group who say that delay in March did cause or cost thousands of deaths. If you're saying this is a delay now and a wrong delay, how many deaths are we talking about now?
Well, I mean, it's hard to put a number on it. We've got better at treating COVID. It hasn't really got into the care homes, which is a really good thing. And it is still a younger population. So it's not going to be the scale that it was in March. And, you know, thank God for that. But it will be probably several hundred hospitalizations, probably several thousand extra. And with that, you get some people who'll die.
How much sort of margin of error is there in your calculations? Could you be wrong?
I mean, I haven't done anything particularly complicated. I mean, you're looking at the recent growth, and that has doubled in the last 6 days, say in the northwest. And then you look, okay, well, if it doubles again in 6 days, we'll be worse than where London was. I mean, it's not a complicated calculation. I mean, it's just literally looking forward a few days. And there's no reason to think that suddenly the growth is going to slow down because nothing's changed over the last week.
Professor, thank you very much indeed.
Now, the Chancellor of the Exchequer has announced a series of new support measures for people whose work is impacted by the lockdown, which is expected to be further extended in the coming days. 2/3 of people's salaries will be paid in businesses that close down, and some business will be able to get cash grants as well. It comes as the economic recovery was shown to be much less robust than had been hoped. Our economics correspondent, Helia Ibrahimi, has this report from Liverpool.
Optimism about UK growth has gone, like the summer. August's 2.1% increase, a bit of disappointment for those who had hoped for a strong V-shaped recovery. And today, in the teeth of bad data and the prospect of further local lockdowns, the Chancellor's hand has been forced again. Just 15 days since the winter plan, Rishi Sunak has now launched a new expanded rescue scheme. In it, the government will provide cash grants to businesses required to close in local lockdowns. They will increase the generosity of the job support scheme, paying workers of affected companies 2/3 of their pay. The new expanded scheme will cover all businesses legally forced to close or restrict operations, including restaurants able to only serve food outside or nightclubs which had been closed in the past.
Throughout this entire crisis, we've tried to protect people's jobs and incomes to a considerable degree. That's what the furlough scheme did. It protected almost 9 million jobs. That's what today's announcement will do, protect the jobs and income of people who happen to work in businesses that may be asked to shut down.
So how does this compare to the Chancellor's previous efforts? The original furlough package started off covering 80% of wages. That was replaced by the controversial JSS, which covered just 22% of pay. Now Mr Sunak will stump up 66%, and the scheme will run from November for 6 months. Just a month ago, Liverpool had seen shoppers return to high street restaurants in droves. Now the town is bracing for a new series of local restrictions based on a government-formulated 3-tier rating system. Natalie Hayward runs cafes and event venues across the city. She's already had to close 2 of her companies and is feeling increasingly desperate.
Because the restrictions have been so severe, it does feel unfair. No way that the trade that we're seeing now is sustainable. We are, as I'm sure many others are, trading below break even. So every day we open our doors, we're opening to lose money. Not just that, we absolutely have no hope in the future.
How has that impacted you?
Personally, I feel an immense sense of responsibility to look after the workforce.
To support them. Is that hard to do in this environment?
Yeah. I asked my staff to fight when they came back in July. And they fought really hard, and we thought by the end of August that we got there.
While today's measures gave some hope to the hospitality sector, many in manufacturing say their need for help is just as urgent. Companies across the UK may still be open, but many will have seen their turnover decimated. JJ Churchill has been a leading aerospace business for 8 decades. Now its boss fears French and German rivals are closing in, with their governments giving clearer, more long-term support.
Those governments have decided that the aerospace and aviation sectors are worthy of long-term protection. They've recognised that it's going to be 12 to 18 months recovery time, minimum. And the schemes that they've put in place, Kurzarbeit and Chômage partiel, recognise that. We tend to have a bit of a tall poppy syndrome in the UK. We don't like to shout about what we're really good at. We are really good at advanced manufacturing, and aerospace is absolutely the jewel in the crown there.
And is it a risk?
Of course it's a risk, absolutely.
Those pressures on British industry have bounced Mr Sunak into further expensive fiscal action, not to mention the demands of the Prime Minister and his new Red Wall recruits, all wanting salve for the financial pain of lockdown. But today's measures will add another several £100 million a month to the burden on taxpayers, a cost many in his party are increasingly worried by.
Heli Ibrahimi with that report. Well, I'm now joined by Lord Jim ONeill, the former chief economist at Goldman Sachs and member of David Cameron's government and closely involved with the Northern Powerhouse project. Thank you so much for coming back on the programme, Lord ONeill. You heard the tears of Natalie Haywood there in Helia's piece. Is the Chancellor doing the right thing today, even if it means trampling on the very principles that he outlined just 2 weeks ago?
I don't think he has any choice, Matt, really. If we want people to comply with these fresh restrictions, 7 months into this mess, we've got to have an incentive to try and support people. I'm not sure whether that moving interview was done before or after the news from him, but hopefully the kind of thing he announced earlier might help people in exactly that position. And I don't really think the Chancellor had any other choice. It's something actually I thought would happen yesterday, and it's close to what I expected.
I mean, this support, the 80% or the 2/3 will come for businesses that have been closed down. Do you think this would encourage some businesses to actually just shut down because their margins are so tight, but then still get the 2/3 from the government?
So in your intro, I pricked up my eyes and ears when I heard you say that, because I suspect it'll really only apply to ones that they are clearly putting restrictions on in that industry. So there's obviously some, hopefully not too much scope for gaming it. But I think the important thing also is that based on the hopes they have, I think, about vaccines, that this notion that it will go on for months on end, I'm not sure if that's what they're planning to, because if that were the case, then it's going to be more challenging.
Well, indeed, but he has said that this scheme would last for 6 months, so they're clearly preparing for quite a long winter, aren't they?
Well, I think if you look carefully at everything they've said since they brought in the 6-person rule, this 6 month keeps getting trotted out. It's my impression that I think they actually hope that early on in the first quarter there is going to be a vaccine available so that some of us can get away from this never-ending seeming mess that we're all in.
Do you get the impression that there is a real rift in the cabinet between those who want to emphasise wealth and those who want to emphasise health, to put it crudely? And if you were still in government, which side would you be with?
Gosh, that was a long time ago now. Listen, I think there needs to be a constant look at optimising these very difficult choices. If you really get me going, I personally think instead of the loan schemes to businesses that have been deliberately impeded by the measures to support the distancing, at the start I was recommending, I think I discussed it with you on air once, that they should have probably provided direct support to their revenues rather than all these loans. But you can't really roll the clock back.
Right.
I think they have to constantly try and optimize these decisions. It's very tough for these hospitality industries. But I think, as you just heard from the infectious specialist, it's pretty clear that too much distancing for too long just causes this thing to go rampant.
Right.
So,
and just briefly on the Northern Powerhouse, I mean, you're Mr. Northern Powerhouse. In 10 seconds, how much trouble is that whole project in now? Double whammy.
Well, they need to start taking devolution really seriously. Test and tracing should have been things like many others that should be given over to people in the north and elsewhere that have devolution agreements. Plain and simple.
Lord ONeill, thank you very much for coming on the programme. Krish.
A little over an hour ago in the central belt of Scotland, pubs and restaurants closed their doors for the next 2 weeks at least as part of the Scottish Government's plan to tighten COVID restrictions. First Minister Nicola Sturgeon defended the plan as another 6 deaths from COVID were recorded and over 1,200 cases. Kieran Jenkins joins us now from Glasgow. Kieran.
Well, at 6 p.m, all the bars and licensed restaurants here in Glasgow emptied out. This whisky bar here actually boarded up its windows, and they won't be opening for another 16 days at least. And it's the same in Edinburgh and across much of the central belt, a population of more than 3 million people. So it's a sort of shutdown in Glasgow tonight, but people are still out, and that is because bar and restaurant owners, many in despair, have organised this ice dump protest. You might just be able to see it beyond these people here. They brought all the wasted ice that they're not serving this weekend, and they're dumping it on the street here, and they say that's to symbolise that the hospitality industry in Scotland is melting away. Now, the Scottish Government says there is £40 million more support for these businesses. The Scottish Hospitality Group says that will barely touch the sides. And Nicola Sturgeon was in an apologetic mood today.
Now, I know how tough this is, and I can't tell you how sorry I am to be standing here in a position where we are requiring some businesses to close again. I am desperately sorry for that, and I know how desperately difficult this is for people trying to make a living, keep businesses that they've worked hard to build up going, and of course take care of their staff.
Well, many of the businesses chucking their ice here tonight say they may not survive this shutdown. That's why they're protesting. But Nicola Sturgeon said she had to act. As you said, there are 6 new deaths announced in Scotland today. Hospitalisations in Scotland are up 80% over the past week. Clearly, the existing measures haven't had the intended effect, so this is what it's come to, and yet more sacrifices being asked of people in Scotland tonight.
Kieran, what's the latest from Northern Ireland?
Well, we've had an alarming statement out of Northern Ireland this evening. On the day it recorded its highest ever number of new cases. They're really worried in Northern Ireland about the NHS there in particular. The Northern Ireland Health Minister Robin Swan has said this evening if the current trend continues, hospital admissions will be higher than the first wave within 2 to 3 weeks. He said the situation is grave and getting more and more so on a daily, if not hourly basis. So it may be that we see more shutdowns like this elsewhere in the UK before too long.